What's great about Community Healthcare Network is, in a sense, what's great about New York City. Every community has its own vibe, its own language in many cases, its own needs, and we pivot to meet those needs. If you are providing medical care, you really have to focus on the patient in front of you. But if you're looking at the broader population, you have to address some of the community ills that ultimately will lead to illness in a human being, in a patient.
We are literally invested in taking care of the entire person, not just one aspect of the person. We take care of people across the entire lifespan, so from our babies to our older adults. We have primary care, we have women's health, we have ID, transgender care, we have mental health services, psychiatric services, we have social work, we have health education, we have dental, we even have a pharmacy at some of our sites. It's really just this place where there's so much care integrated.
The Community Healthcare Network began with another identity. It began during the 1960s with a series of neighborhood storefront family planning clinics. Women's health, primary care, medical care from pediatricians and internists. By the 1980s, the city of New York pulled them together in something called the Family Planning Council. The HIV epidemic is spreading across New York. Community Healthcare Network was out there early, providing care, treatment, embracing in a non-stigmatized way care that people needed. That really was a single entity that grew by the 1990s into the Community Healthcare Network. Flash forward to 2020, COVID hits. No one knows what the heck is going on. But early on, in partnership with Reverend O'Connor's church in Jamaica, Queens, we were among the first groups to do testing. Testing was the first wave of battling against COVID. A year later, we did the same thing in the same kind of partnerships to get people vaccines. The way to look at Community Healthcare Network's history is that we evolved to meet community needs and human needs within those communities.
Housing and healthcare are two great anchors. The people we see are people who are at the edge, who without collaboration and support from partners would not be able to live their daily lives with quality. We're here in Jamaica, Queens, on the site of the new CHN clinic. It used to be a parking lot. The church, through its community development organization, created an affordable housing development. And we were fortunate that CHN chose to join the development.
We did assessments with a lot of people in the community, and something that came up is around almost creating like an oasis for families. We're meeting people where they are. We're not asking them to come to us. We're located next to people's homes, where they shop, where they go to school, where they go to work. And it's really a beautiful thing to be able to serve people in their natural environment.
CHN's new building in Jamaica is a statement that it's committed to joining the fight, not just for today, but for the long term.
The most important future aspect of healthcare in New York and really anywhere in the country or in the world is to tackle within a medical framework the social needs, the economic needs that patients have.
We see it every day where someone comes in for one thing and prior to them leaving, they're able to get connected to so many things. Whether it be care management services because they need support with managing their chronic health condition, whether it be their introduction to mental health services because they've been experiencing trauma, anxiety, or they needed support around their transition journey and their experience. I think CHN just is like an umbrella for all the services one needs in order to have good health outcomes.
There's a commitment to quality, and there's a commitment to fighting for what every American deserves.